I'm Caitlyn. I'm a physician assistant working here today. And you are, your name?
Susie.
And your date of birth?
11/2/78. I know it's not the right one.
Okay. Okay, and how are you doing today?
Okay, how are you?
Good, thank you. And what brings you in today?
I've been having like burning and a pressure when I go to the bathroom.
Okay. And how long has this been going on for you?
Past 3 days.
Anything seem to make it better or worse at all?
Well, actually, I called my doctor and he gave me a prescription, and I've taken that, but it seems like it's getting worse.
Okay. Do you remember the name of the prescription what he
It's,
gave you?
Macrodantin.
And you said it hadn't helped you, it's getting
No.
worse?
It's helped before, but not this time.
Okay. When you say it's getting worse, just is the burning getting worse and the pressure getting worse?
Yeah.
Okay.
It seems like I go more.
Okay. Are you having any pain anywhere else, or is it strictly just? So you said that you're going more often? Small amounts, small quantity, or a pretty decent quantity every time you go?
Once in a while, it doesn't seem as much as usual, but there's always something.
Okay. And have you ever had this before?
I guess a couple times.
When was the last time you would say that you experienced this
I think
before?
it was like 3 weeks ago.
Any fever, chills, any back pain,
No.
any nausea, vomiting?
No.
And are you sexually active? Any history of STDs in the past, gonorrhea, chlamydia, herpes? Do you have a gynecologist that you see?
Oh, yeah.
Okay. Do you have any allergies?
No.
And are you currently on any medications?
I just take breast control pills.
Any medical problems, hypertension, diabetes, high cholesterol, nothing? And how old are you?
32.
Any surgeries in the past?
No.
Any accidents or injuries? And any family history of any cancer, urinary problems?
My father died of a heart attack. Other than that, everything else is good.
And do you smoke at all?
Yes.
How many packs per day or cigarettes
Pack
per
a
day?
pack.
Half a pack. And how long have you been smoking?
About 10 years.
Any alcohol use or drug?
Socially.
Okay, any illicit drug
No.
use? And since you see a gynecologist, have you ever been worked up for STDs at all, or
No, I mean, I get the PAPS.
the pap smear? Okay,
Never had any problems with that.
okay. Just gonna do a physical exam.
Okay.
Just listen to your heart first, so you can just relax.
Yes, I get more closer.
And I'm just gonna have you try this.
Sure.
And deep breaths through your mouth, please. And 2 more. Any back pain when I do this?
No.
Okay. And can you lay down, please? they tested your urine, which you did, which is showing that you have an infection, most likely a bladder infection. I'm not thinking anything beyond that because you're not having any back pain. Sometimes we worry about if it's spread to your kidneys. So I'm going to give you an antibiotic for that. I'm also going to give you something that will help with the burning. But one thing to note is that it can turn your urine orange. So don't be alarmed. You'll have that for about 2 days. And then I would also like to, when was the last time that you were at your gynecologist?
6 months ago.
Okay. I would like to, just to cover all bases as long as it's okay with you, just we can do a blood test just to do an STD workup since you are sexually active, just because sometimes that can cause some burning with urination. And then if you're more comfortable, you can see your gynecologist to do a gonorrhea or chlamydia test, which they would have to do a pelvic exam for. So we can do that here, or if you're more comfortable making an appointment for that, we can do that there as well.
Alright.
Did you have any questions about anything?
No.
Okay. Just some helpful hints. Since you are sexually active, a lot of people can get the urinary tract infections from having sex. So though it's not always romantic, just sometimes maybe try and go to the bathroom after having sex. Just make sure that you're going to the bathroom when you need to go to the bathroom, that you're not holding it for too long. And if it's ever becoming to the point where it's becoming very frequent, then we can look into maybe giving you something more for prophylaxis to prevent you from getting them.
Okay.
Okay?
Great.
And no questions?
No.
Okay.
Alright then.
Thank you.
Thanks.